Welcome to another episode of Coffee and Clary, Preventing Substance Misuse. My name is Sophie, and I am joined today by Reyna. In today's episode, we're talking about the work happening in Martin and Faribault Counties around opioid use disorder prevention and recovery.
Today we are joined by Shelly Larsen, Project Coordinator for Mix-Up Coalition, who has led many impactful initiatives like Narcan training and the Lock It Up campaign.
We're also speaking with Caroline McCourt, who played a key role in managing the distribution of opioid settlement funds in our country through the Stronger Together Coalition, which helped ensure that these funds are being used to support both prevention and recovery efforts in our community.
Together, Shelly and Caroline will share their thoughts on the current state of opioid use disorder in our area, what is happening to tackle this issue, and how the settlement dollars are being used to continue making a difference.
They'll also discuss the long-term impact these funds can have on our community and how we can play a role in supporting prevention and recovery. Grab your coffee and join us for this important conversation. Caroline and Shelly, can each of you tell us a bit about yourselves?
Yes. I am a current Fairmont resident. I'm a Martin County US graduate. I'm a mom and a wife and a public health employee and a CrossFitter. And how many ands do I get?
Can
I don't know how much to keep saying.
I am a project coordinator for Mix-Up Coalition and also a prevention specialist. I am also a wife, a mom, and a grandma. And I'm also a CrossFitter, and Caroline is one of my coaches. So, small world.
Yes.
So, Caroline, can you explain what the opioid settlement funds are, how they came about, and why are they important for Martin and Faribault County?
So this problem started in the 1990s. And deaths were happening and occurring due to overdoses, but it wasn't necessarily connected and kind of going under the radar. And since 2000, the annual number of overdose deaths from any kind of drug in the U.S. has multiplied nearly 6 times over, rising from 17,500 to over 106,000 people in 2020. So the vast majority of these deaths involve some form of opioids, including heroin, prescription painkillers, and most prevalently in recent years, synthetic opioids such as fentanyl. So, clearly realized that opioids were not as they were advertised, that they were habit-forming and they were addictive, and attorneys generals gathered together to pursue this lawsuit. So this was likely at least 10 years in the making of gathering evidence and information and working towards this lawsuit. Initially, 14 states were included in it. Minnesota was not included initially, but after July of 2021, Minnesota did join, and so we were allowed in, if you will, to then the benefits of having taken these companies to court, getting through all of these agreements because they agreed to settle versus going to court, and so they were able to settle with an amount that they were okay with relatively, versus going through a long court battle. And so certain companies are ending up paying over $26 billion. And that's not to just one state, that's ultimately now to about 21 different states that are included in this settlement. And there are a few more settlements that are still hanging out there. So right now we have an amount that we'll be receiving, or that Martin County specifically will be receiving, but it could be more. One of the perks of these pharmaceutical companies is that they can tie things up in court for a number of years. And so the actual culprits are still working on, like the Purdue Pharma and the Sackler family are still that settlement is still potentially hanging out there. And so while they were able to get settlements from these companies that participated, such as Johnson & Johnson, CVS, Walmart, Walgreens, McKesson, Cardinal Health, and AmerisourceBergen, there still is a couple, that are hanging out there. So that answers the first part of the question of how they came about. So Minnesota joined the settlement in 2021, ongoing litigation, and currently, here we are in 2024. Martin County has received 4 payments of the settlement that is anticipated to last for about 18 years. And so these funds are front-loaded. And so we've received over $243,000 in our county so far, and anticipate receiving up to $947,000 by the end of 18 years. Now there still are some court battles, as I mentioned, so it could be more. It won't be less, but it could be more. But these funds are very significant because we really do not typically receive this amount of funding to be spent on prevention and treatment and recovery in our counties locally. There is funding that is going towards the state to be able to do a statewide initiative and statewide prevention, treatment, and recovery efforts, but we typically don't get, especially that volume of money to be used in a really wide variety of ways. There's over 126 strategies that you could do with the funding, and it usually doesn't happen this way, so that's why it's significant.
Shelly, from your perspective, can you describe the current opioid use disorder landscape in our communities? What trends or challenges are we seeing?
Sure. Well, the opioid use or the opioid epidemic is still of significant concern nationally at the state level and even in our county. And as Caroline mentioned, it's over 100,000 deaths. And in Minnesota, in 2022, 2023, we had over 1,000 deaths in our state. In Martin County, Minnesota, I believe since 2014, we've had 5 overdose deaths due to opioids. That can be both accidental and maybe because of suicide. So 5 is still too many, right? We've lost 5 people. So if you look at the trends since 2014, nationally and at the state level, you would see just this continual rise in overdose deaths due to opioids. In 2018, we saw a little bit of a dip down, and then it skyrocketed. And that is when the synthetic opioids came into play, and specifically one that many of us are aware of are fentanyl. 92% of all opioid-related overdose deaths are fentanyl was involved. And then of all overdose deaths with any drug, 62% of them involved fentanyl. So that's definitely a trend we're seeing. The good news is that in 2023, we finally now have seen a little bit of a dip downward. And I feel that what's trending is that we're really starting to push education. We're trying to reduce stigma, to really encourage people to get the help that they need if they have an opioid use disorder. And so looking at Martin County, we ultimately want to see our statistics go to 0, and we want to educate our communities about the dangers of opioid use, but we also want to have safe, safety and harm reduction education in place, like what to do with your unused prescription drugs and never to share pills or prescription drugs, and that it's okay to ask for help. And so those are some of the things that we're starting to see in our county, and the opioid settlement dollars will help us advance that effort.
So, Caroline, could you walk us through the process of determining how these funds will be distributed and how and who is involved?
The first settlement funds came out in 2022, and they just went out to counties. They just were distributed to every county. They received them. There wasn't necessarily a plan around how to use them. The money just came out. And so there was a lot of concern that this would end up being like the tobacco settlement funds that had come out sometime that I did not look up, but tobacco settlement funds came out, and they really weren't utilized for tobacco, to fund tobacco prevention and cessation programs. Only about 3% of the funding that came out as a result of the settlement with tobacco companies actually went to addressing tobacco control issues. And so public health was named as a chief strategist for how the opioid funds would be distributed and how they would be spent in their communities. Well, that was statewide. And that might have just been a Minnesota thing, but that might actually be wider than Minnesota. But I know in Minnesota, public health was named as the chief strategist just to ensure that there was a strategy around it, and that there was data and assessment in a true public health fashion. We like to assess what's going on. We like to know what the size and the scope of the problem as best as we can. Numbers only tell one story, one side of the story, but as best as we can to get that piece of it. So we assessed our environment, and that included focus groups in our community. And so we met with those who were part of substance abuse prevention coalitions, also other stakeholders like healthcare providers, service organizations, school nurses, law enforcement, emergency medical services, those with lived experience and those who love those with lived experience, and then those serving people with lived experience. So those focus groups aim to get information from those who are closest to the source or closest to the issue. We also worked with a contracted evaluator to put a lot of this information together for us and to conduct a community-wide assessment so that we also had community feedback, but certainly weighted the responses of those who were closest to the issue a lot higher than, someone who just may have strong opinions on where funding should be spent, but really may not understand the size and scope of the problem. We also utilized the Johns Hopkins tools that were available to public health. They created these, they looked at all the ways in which you could impact prevention, treatment, and recovery, and created 126 different strategies where the funding could be spent, but also had some pretty specific funding principles, such as spending money to save lives, using evidence to guide spending, investing in youth prevention, focusing on racial equity or equity in general, and then developing a fair and transparent process for deciding where to spend the funding. So we worked through our coalitions that already existed, because in a rural community, it's really hard to say, hey, I know you're interested in this topic, come join our thing, come join this thing, instead of pooling our time and resources together, because often it is the same people involved in the same coalitions, and so wanting to make the most use of everyone's time. And it already aligned well with our community health improvement plan and our community resiliency team strategies, which included addressing substance misuse in our counties. To sum it up, the community was involved in a wide variety of ways. So you may be hearing this and thinking, I didn't get to participate. And if that's the case, please reach out. We use social media and emailing our networks and asking our networks to email their networks to really get some of the word out for the assessment, but also for some of the focus groups that we held. We put signs up around the community and worked within the recovery communities too, to be able to hear from anyone who was willing to be involved in this work. And I think it's a later question that you ask, but just to remind early and often that you can visit our website at www.fmchs.com. Maybe it'll be linked, to find out more information about the opioid settlement and how you can get involved if you would like to.
Caroline, can you explain how the distribution of opioid settlement funds was made to address the unique challenges and needs for our communities in Martin and Faribault Counties? What local factors were considered in deciding where these funds would have the most impact?
So as I mentioned, we conducted an assessment, and part of our work with our contracted evaluator was to then, make sense of all the responses and of the assessment. We then went back to our Stronger Together coalitions as well as our community resiliency team to rank the results and the priorities for Martin and Faribault County, and so utilizing the input of community stakeholders and those working or living in these communities too, to prioritize where the funding should be spent, or so that they can rank and list where the priority could be, with the options and with the responses of the opioid landscape assessment.
Shelly, as someone with lots of experience in intervention and prevention work, what were some of the priorities you hope to see addressed with these settlement dollars?
There are three main areas that I really hoped would be addressed, and they were, and so I'm thankful for that. And the first one is education prevention, expanding what we were already doing as a coalition and as a community. So investing in education initiatives targeting youth and families, I think, is really important in this work. Programs in schools, evidence-based curriculum can really equip young people in the knowledge, giving them the knowledge and the tools to resist substance misuse. And then additionally, public awareness campaigns that help dispel myths about opioid use, and then educating the broader community about risks and resources that are available. And then I think a big thing in all rural areas, they're all up against this. We're always feeling like we have a shortage of resources, and there's maybe more obstacles in the way for those in recovery to get help. But so looking at that recovery infrastructure, so supporting individuals post-treatment, that's just as important as inpatient care when they're receiving that treatment. And so resources for sober living environments. And a big thing now is the peer recovery specialists, or those recovery coaches, to help walk alongside those. So peer recovery specialists walking alongside those in recovery are an integral part of helping them get integrated back into the community and maintain long-term recovery. And then the last one, that I thought would be very important is the continuation of naloxone education. So what naloxone is, it's a life-saving tool that reverses opioid use for a amount of time, so that first responders and people are able to get help. And so educating community members, first responders, schools, communities on naloxone and how to use it was very important. And it's used as a high impact immediate priority. It's harm reduction, so that we don't see those overdose deaths and that we can get people the help that they need right away.
Caroline, can you share some examples of programs or organizations that received funding? How will these funds support prevention and recovery efforts in our counties?
There were local factors that were considered in deciding where the funds would have the most impact. We took the results of the assessment, and priority was given to those applications that met the top priorities identified on the assessment. And so that was part of the application process for those receiving funds, was to identify if they were addressing one of the priority areas in either county. And they received a few extra points for that. We did have one applicant that was doing something that wasn't identified as a primary strategy, but there was enough funding available, and so even though they didn't receive those priority points, they're still able to request and receive funds, because, as I mentioned, we believe we had 3 primary treatment priorities and 3 primary prevention priorities, but there were over 126 different strategies. So even if it wasn't a priority, you still could request funding to do that. So this round, and when I say round, this is a pilot process. This is our first year, and so just seeing how this goes and seeing how the 1 year of offering the funds will impact change. I mean, oftentimes, and certainly in prevention work, you can do something and you might not see the result of it until 10 or 15 or 20 years later. It is a really hard part about public health prevention, but it by no means doesn't mean that you shouldn't be doing that. It's a lot of double negatives, but it by no means invalidates that work at all. It's still very essential and important, even though you may not be able to measure that within 1 year. So we have 4 different applicants this year. Healing Hearts, which is they were wanting to hire peer support specialists or recovery coaches to connect people to services and supports and provide services to those in recovery. They already do a portion of this, but this funding allows them to expand. My own organization, Faribault Martin County Human Services, applied and received funding to be able to support we have a recovery specialist who works with families and to help treat opioid use disorder, such as providing mobile interventions and withdrawal management services, provide wraparound services such as case management, employment training, and counseling to individuals in treatment and recovery for opioid use disorder. So really heavy on that treatment aspect, and then that reintegration in the community piece that Shelly was talking about. MixApp also applied, and they are working towards a treatment priority, so within schools, developing and implementing programs to screen for opioid use disorder and refer individuals to treatment, and then also really focusing heavily on the prevention priorities, as you guys are well aware of too. But as one of the strategies was to fund programs in schools that have demonstrated effectiveness in preventing drug misuse and to fund community anti-drug coalitions that engage in drug prevention efforts. The other organization that applied for grant funding is Celebrating Families, and they applied under the approved strategy of prevention, so creating or supporting community-based education or intervention services for families, youth, and adolescents at risk for opioid use disorder and any co-occurring substance use disorder and mental health conditions. Because a lot of the things that will help to prevent opioid use also work to prevent a variety of other substance use disorders too. And if we leave mental health out of the equation, we really there's a huge missed opportunity, as oftentimes if there are unmanaged mental health conditions, it can be very easy to turn to substances as a way to self-medicate or to manage. So those are the 4 that received funding this year. Out of the $249,254 and $28 that we had available. There was $96,000 requested in funding in Martin County. The amount requested is about $96,000. Total was $96,000, and it was a pretty even split between treatment and prevention, which mirrored the results from our assessment as where the community wanted to see funding go towards, between treatment and prevention. So not really heavy one way or the other, but really addressing both of those strategy areas. They will have a whole year of funding available. They can certainly reapply for funds as funds are still remaining and as we continue to get funding in. As I mentioned, it might be hard to measure how successful they are in 1 year. So we're really working there's required reporting, but really working to have a good way to assess what's happening and figuring out how to assess all of the things that MCSAP is doing, since there are multiple strategies that they're requesting funding to continue their work on. So it can be hard to accurately capture that picture of the work that's happening and how it's impacting change in our community.
So Shelly, even though the OUD grant has ended, are there prevention initiatives that grant that can continue to make an impact, and how do they align with the new funding priorities?
The OUD grant did a few things for us. It really helped us to launch our community awareness campaign, and that will continue. So a couple of things that we were able to do is provide that community awareness where we educated and reminded people that there are drop boxes in Martin County that you can drop off your unused prescription drugs. So that we called our Lock It Up campaign, and we partnered with law enforcement. We also have partnered with our area pharmacies to provide medical lock bags for people to lock up their prescription drugs and even their edibles. And that campaign was really to reduce harm so that we could keep toddlers, our young children safe so that they didn't accidentally get into those prescription drugs or substances that would be misused and could potentially harm them significantly. And so those were free. We were able to do that, and we wrapped those up. We gave away all of our medication bags starting at the Martin County Fair and then dispersed them to pharmacies. And then in addition to that, we purchased DeTerra prescription bags where you can it's a little kit where you can, your unused prescriptions, it'll dissolve the prescription drugs so that you're able to dispose of them safely. And so right now, those are at area pharmacies. They're free. You can ask for them until they're out. And so we had that initiative going through our past OUD grant, our opioid use disorder grant. And we also did many billboards so that our communities would see the Lock It Up and what does it mean to keep our families safe. So those initiatives continue. through grants, but then with the opioid settlement monies, we were really able to enhance education. We started that process, and as you two know, you do very well. Our Empower groups in all of our schools do very well with peer-to-peer education, and so now we're able to enhance that with working with the schools, the social workers, to offer education for maybe at-risk youth who are at risk for using substances or maybe are using substances, where they can do a screening brief intervention and then if needed a referral to treatment, and then also evidence-based education, teaching skills, teaching students about life skills, so resiliency, how to manage stress, and also, to make healthy choices. What does it mean to have that overall well-being in your life? And then our hope is that through that education and learning about substance misuse, that then they will not misuse substances and that they will make healthy choices. So that is being launched in our some of our area schools right now as pilot programs, and that is in part to the opioid settlement funds that we're able to enhance those projects.
What role do prevention and recovery efforts play in addressing the opioid epidemic long term, and how do you both see these funds contributing to long-term change?
Regarding prevention efforts and the role that they play, I think one of the most impactful things that we can do is to address root causes with our youth right away and start talking about the why. Why do we want to make healthy choices? Why do we want to abstain from substance misuse? And so prevention, we focus on reducing risk factors and strengthening protective factors that influence substance use. So this includes education about the dangers of opioid misuse or any really substance misuse. We want to promote mental health and then fostering resilience in individuals and our families. And then, prevention efforts with youth-focused strategies. So again, going back to that education and empowering youth and giving them the life skills that they need to make those healthy decisions. Initiatives in schools and communities can cultivate those healthy decision-making skills, and also peer support networks, which Empower does. They really reach out to younger students, and you guys are role models to them, and they know that you're making healthy choices, and because of that, and they know your why because you share that with them, then they in turn are thinking, I need to make those healthy choices too. And again, community awareness and engagement is so important when it comes to prevention. Prevention involves the entire community. So we want everybody to know that they can be involved in that. That public awareness campaigns help to reduce stigma. We want people to know it's okay to get help. It's okay to have treatment. And we want to build that culture of prevention within Faribault and Martin counties and in our nation. Collaboration is so important with our parents and our schools and our businesses to ensure that message it reaches every community. Funds contribute to create that sustainable change. So building those comprehensive programs, expanding accessibility, and strengthening local capacity.
That's a hard answer to follow, but it just reminds me of an illustration. Because everything you said was spot on. And I wish I could have said it better. But it reminds me of an illustration. So if you picture yourself standing on the bank of a river, and you know the illustration when I explain, but
I do.
It just helps to provide that, why do we look upstream? Standing on a dock, on a river, and you keep pulling people out. As people are coming down this river, needing help, needing you to rescue them, and you keep pulling them out. At some point, you have to go up that stream to see, why are people falling in this river in the first place? What is happening that they're falling here? And create systems of support at that point. Sure, pulling them out of the river is also very, very important and very helpful. And, preventing them from falling back into the river is great as well. But also having those pieces to address why someone might fall into that river in the first place. So that prevention and recovery absolutely goes hand in hand. It's really good economic sense for your community as well, to take a vested interest, and allowing for people to be as to meet their potentials as thriving citizens of your community as well is really important. So having supports for parents, having supports for people who never had kids or who had kids and have moved on, just making sure that there are supports in place for everyone in our community is really important. And MCSAP plays a vital role in that, absolutely, for our youth prevention and resources for parents.
Shelly, based on your experience, what gaps in services or resources still need to be addressed in our communities? Are there opportunities with the settlement funds to fill those gaps?
Yes, there are. The one that sticks out most to me, again, I've already said it, but it's going back to stigma around addiction and recovery. So stigma remains a significant barrier, and like I said, it prevents individuals from seeking treatment and support, and it creates challenges for recovery integration. So what the opportunity is with that is that we can allocate those funds to build those awareness campaigns and to reduce that stigma and to normalize seeking help. We can highlight recovery stories. That's very powerful. People who are in recovery that are successful, to share their stories. And I think that gives hope to people to know I can recover and it's okay to get help. I think of, and I've already talked about this too, the lack of long-term recovery support. So again, those wraparound services with support specialists or that recovery coach that can walk alongside those who are in early stages of recovery, to know what resources to reach out to, who to contact, and just really simply for encouragement. I think within our area schools, we have the opportunities to develop and implement programs to screen for the opioid use disorder. And as I said, we have a pilot program that's going on right now, and then refer individuals to treatment if needed. And so we're hoping that that will be successful. And yes, there are many opportunities to with the settlement money to fund these programs. And so we're very thankful for that settlement money, that we can do our work and enhance our work in prevention and in treatment.
Caroline, looking forward, what do you see as next steps for implementing and monitoring the impact of these funds? How will the community be kept informed about the progress?
That is a really good question. And some of the aspects of it we're still figuring out as far as the best ways to inform the community. So there's, as I mentioned before, there's reporting that is required by those doing the work that aligns with the work they've been identified. So we're honestly still working on some of those parts. How do we collect the meaningful information that can then be shared out to the community in a way that it makes sense to the community? I mean, I could certainly create something that shares a bunch of numbers or rattles off they're doing XYZ, but if it's not fully telling the story or having that personal aspect or that human aspect to the story to really share about what's happening, it really doesn't mean much. So trying to find the best way to really communicate that back with the public. But you can find that information on our website, as well as when I make the rounds to other coalitions, like I've done at MCSAP, and other meetings, just to share what's going on and how what the quarterly reporting pieces look like. So within this first year, it certainly is still a pilot process and figuring out what that's going to look like, and how quickly some of the work can actually happen. So we really have a lot to still just see. And as I mentioned, going to MCSAP to be able to report back. I will also be checking in with our County Board of Commissioners, because they ultimately have the final say in where the funds were distributed towards. So after our Stronger Together Coalition looked at it, I then still had to go to our County Board of Commissioners and say, these are all our grant applications we received. They reviewed them and then requested that County Board approval to be able to get funds out. And so just reporting back to them to let them know how things are going, and being that resource and that technical assistance provider for our grantees, as we're calling you guys our grantees who's receiving funds.
How can community members get involved in supporting prevention and recovery efforts or advocate for ongoing work.
So as I mentioned before as well, you can certainly check out our website with Faribault Martin County Human Services, so www.fmchs.com, and there's an area for the opioid settlement work, which I believe has my contact information there, or ways you can ask questions. You can submit a question and we'll get that information to myself and whoever else needs to see it. But also joining our Stronger Together coalition. We are always looking for community members and people who are willing to join to have a voice in the community health improvement plan that guides a lot of different activities that we do in our communities. So always looking for community members. And there is also a tab on our website for Stronger Together that will give you an area in which you can find the contact information for Jordan Niles.
And just to add to that, community members, really do play a vital role in supporting prevention. And so I would say as community members to take the initiative to educate yourselves about opioid use disorder and the initiatives that are happening with the settlement dollars, initiatives that are happening through Stronger Together Coalition and MixUp Coalition. Volunteer your time and your skills. If you are somebody that's been in long-term recovery, consider being a peer support specialist or a recovery coach. If you are wondering how you can get involved, come attend those meetings. Come attend a Stronger Together meeting or a Mix-Up Coalition meeting, which we meet the second Thursday of every month from 11:30 to 12:30 at the SMEC building here in Fairmont in room 112. And so you are invited, officially invited. And then also learn about Narcan, learn about naloxone, and learn how to use it and carry it, and which reverses opioid overdoses, and bring awareness to others about what that is and what it means and how it can save a life.
What gives you hope as you both reflect on the work that has been done and the opportunities ahead with the settlement dollars?
I think a lot of things give me hope in this, in that there are already existing coalitions. So when we were assigned this work, but when we were named as chief strategist, we really knew who that we wanted to talk with first. We really knew where to go, and that was a huge help. So the community already being aware of substance abuse issues, and we're just getting more specific on one within the opioid landscape. But we really have an opportunity to build something and build systems and reduce stigma so that we don't end up with a huge opioid problem. It's pretty unique in our area in that sense that we have all this funding, and if you look at data, which is just one piece, it's a small p right now. It's a small problem. It's a problem, but it's not as vast as it certainly could be. And so this gives us a really good opportunity to get ahead of it, to start reducing stigma, to make sure that these prevention efforts are in place, and treatment strategies are in place, and then that the recovery ecosystem is built around people.
There's one thing that really sticks out to me in regards to hope for the future, and that is youth engagement. Seeing the young people that we have in our Empower groups take very active roles in prevention. I don't know if you guys realize how huge this is, but it's really big because your leadership ensures that future generations are a part of the solution. I think your impact could be and is and will be one of the biggest impacts that we will see going forward.
Thank you for tuning in to this episode of Coffee and Clarity, Preventing Substance Misuse. We hope this conversation provided more understanding of the important work being done in our community to address opioid use disorder and the opportunities ahead with the opioid settlement funds. A big thank you to Shelly Larsen and Caroline McCourt for coming on the podcast with us today.
Be sure to join us for part 2 of this episode, where we'll sit down with key individuals in the recovery world, including Rich Odom, to hear their perspectives on the topic. They'll walk us through the realities of recovery in our community and how these funds are impacting those on the front lines.
If you're interested in learning more or getting involved in prevention and recovery efforts, check out mixupcoalition.com for updates and resources. We'll see you in part 2. Until then, stay informed, stay engaged, and keep the conversation going.